To talk about the medications, I'm actually going to focus on the 2 antifibrotic medications because I think those are the ones that have the biggest cost at this point and seem to be some of the hardest to obtain, and that's OFEV, or also called nintedanib, or Esbriet and pirfenidone. There's also other high-cost medications which may have similar programs, and we're going to talk a little bit too. I know Starlet will talk a little bit about some of the immunosuppression medications. Celsep, which is also mycophenolate. Celsep is the brand name you can get through the manufacturer Genentech, and then there's some other programs to obtain those medications. I did want to say, before I start the rest of this, I'm in no way an insurance expert or specialist. Most of what I know is from dealing with all the various assistance programs and helping my patients, and also some of the issues my patients have gone through that we work together to help to correct and navigate and fix for them best we could. So again, I mentioned the 2 the medications we're going to talk about, mainly the antifibrotic meds. And I did want to let you know, I hope you're aware your healthcare team wants to do what they can to help you get these medications and any assistance. So, and we realize that the cost of these medications are, and we know that when we tell you the medications that they're costly, that's something that really sticks out. And I have a lot of folks that are just so frustrated. It's hard to get past that first part, but we are here to try to help you through, and I hope some of these resources will help as well. So again, I mentioned the 2 antifibrotic medications. We have pirfenidone, which Esbriet is the brand name, and it's through Genentech. And then pirfenidone also has generic options, and then you have a nintedanib, and OFEV is the brand name through Boehringer Ingelheim, and there's no generic option at this point. So in order to get these medications when they're prescribed by your physician, the one thing that needs to happen is a prior authorization, and that's done by your primary pulmonary team, your pulmonary care team. And those medications with the prior authorization will come from a specialty pharmacy that it will be mailed to you. Some hospitals will have specialty pharmacies, and some hospitals will even have a 340B status. This is a program that allows hospitals to stretch limited federal resources to reduce the price of outpatient pharmaceuticals for patients and expand healthcare services to the patients and communities they serve. Now, if your hospital has a resource such as this, your healthcare team should be directing you to that program. Not all hospitals have a 340B status, though, because I know at Michigan we do not. And again, as I mentioned, the prior authorization, many of the medications used to treat interstitial lung diseases will require the prior authorization. There are times, unfortunately, when your insurance may deny that medication for whatever reason. We never can figure that out half the time. But your pulmonary team is going to continue to do what they can to get that approval. Sometimes they have to write a letter. Sometimes they have to do something called a face-to-face or peer-to-peer, which is a phone call. And sometimes when they do all these extra denials or appeals on these denials, they may even need you to sign a form giving us the permission to kind of appeal on your behalf. So these are important to get this denial appealed. And there are some times when your insurance won't, they'll just continue to deny it. When that happens, that's helpful to have that information because that will be used towards trying to get the free medication, which we'll talk about in a little bit. They need all that paperwork. So it is frustrating when the insurance denies our medications, but your pulmonary team is there to try to help and fight for you. And hopefully they're able to get it, but if not, we do have some other options. Now, once the prior authorization is obtained, the pharmacy will be made aware, and then they'll call and say, okay, this is your copay. Now, when you get that call, we realize that's the call you're kind of waiting for, and we know sometimes the cost may be something you're unable to afford. We also know you're paying for lots of other medications, and so even if maybe you think, gosh, I should be able to afford that, if you're on 10 other medications and they all cost a certain amount, that's going to add up. So if you feel like this cost is something that's going to be difficult for you, let your pharmacy team know that. These are specialty pharmacies. They usually have assistance programs within them or folks to kind of help with assistance, and they can help direct you to some of the options we'll talk about here shortly. Or, of course, reach out to your pulmonary team because they're there to help you as well. Many pulmonary programs or hospital teams will also have social workers, so that's another option to reach out to. The social workers can help navigate some of this for you, including prescriptions that are not associated, with your ILD disease. So they're there and they can kind of help with that. So the three kind of assistance options we have essentially are copay cards, grant programs, and free drug programs, also called patient assistance programs. And as you know, everything in medicine is shortened to, so it's PAP, P-A-P. And although we're going to mainly, as I mentioned, talk about the OFEV and Esbriet, there are many other meds that could have assistance programs available, and they all have a similar process that we're going to talk about, but they'll vary in their income limit and the amount that they'll cover. All right. So for copay cards, and you should have a form with all these phone numbers and some of the links that Starlet will have, just so it's a little bit easier because there's a lot of phone numbers and websites there. But for the copay card, Open Doors is for BI or Boehringer Ingelheim, and you can actually call them and they will help you with any kind of assistance options. They can also help you with a nurse, and they can help you with kind of some social support. I think they have some folks like a mentoring program. But if you have a commercial or private insurance, you qualify for a copay card. So you can just go ahead and go right to their copay card. Esbriet also has a copay card, as well as some of the generic pirfenidones as well. Now, to obtain a copay card, again, it's for private or commercial insurances only. If you have Medicare, Medicaid, or any form of government insurance, TRICARE, anything, VA, you won't qualify for a copay card. Yep, any Medicare, yes. Yep. And if your insurance doesn't approve the medication, you can't qualify for the copay card. Won't. So if you have a private insurance and that private insurance doesn't approve your OFEV, for example, you can't apply for a copay. You cannot apply for a copay card for whatever reason. That's, I guess, what they say. And then, so as it's noted, there is no income limits for copay cards, but the range to you can be anywhere from $0 to $5. There are yearly limits for these cards, and for the OFEV and Esbriet, what I found is they'll pay up to $25,000 a year. Again, this is for your commercial and private insurances. They do need to be renewed every year. And I did find a couple of the copay cards that if you have like a bill at the pharmacy and you apply for a copay card, they actually will pay back one of them was up to 180 days prior, but you'd have to find out with that copay card. All right. Okay. So the grant programs. Well, this is where we run into little hiccups right now. So the grant programs are based on disease states. There are 4 of them that have had funds open for pulmonary fibrosis and/or idiopathic pulmonary fibrosis. However, they've kind of opened and closed throughout the year, which has been very frustrating. There's also the Fund Finder, which I had one of my pharmacy techs say that's one thing she looks at frequently, because maybe there's a new assistance program that opens up and that will pop up there. So these are, some good places to look. These are also the places that your specialty pharmacy should be looking, and a lot of specialty pharmacies are aware of issues with costs and will put folks on wait lists, and they check these frequently and do try to reach out. I mean, I had someone 2 weeks ago that was able to get a grant, so I know that they are kind of still out there. It's just they, again, have been opening and closing, and they seem closed more than they're open, unfortunately. My only concern is what's going to happen at the beginning of next year. I'm hoping they're open a little bit more, but that's definitely going to be something we'll have to look at in the beginning of January 2024. These programs are all nonprofit, and they're donation-based. So that's, I think, where some of the issues with them opening and closing. And they are based on income, and a few of them, very few require anything other than you calling to give them some information. Some do require us to write a form or sign a note that states what your actual diagnosis is, because again, it's based on your disease. All right. So how grant programs work? Again, they are based on your income, and it's based on a percentage above the federal poverty level. And so there is a little link to check what that number is for you. And so I kind of put that in, should be in that sheet I had given you. But just to give you an example, like if someone had made $60,000, they were 304% above the federal poverty level. Folks who live in certain areas, specifically Hawaii and Alaska, and I thought at Puerto Rico as well, they are calculated a little bit differently, but it says that on that finder. One thing I wanted to mention, because these grants are disease state based, not drug based, so if you're on one of the antifibrotics and you have side effects and your physician switches you over, that grant carries over to that other medication, which is the one good thing. They're also a set amount, so you're usually around $800, I wish, $8,000 to $9,000, and it's important that you're kind of aware of that amount, because once that amount is depleted, then you have to take over what's left. Like if that fund is depleted and you have a couple months left of that year, you have to pay for that. So if you renewed in January of 2023, this October, November, December is when I get worried, because that's when I've had folks who have run out of funds and then they're being charged their copay. So really important to kind of keep an eye on that, which I know is frustrating with all the other things that you have to keep an eye on. So I don't know, maybe you can, if there's a friend or a family member who said, what can I do to help? You can say, can you keep, a couple months, can you ask me to find out how much is left of my grant? The pharmacies are supposed to help with this, but I've had some folks who've run into issues. Couple different examples. One who was called and said, okay, we're sending you your medicine. It's this much. Well, she assumed she still had her grant. She said, okay, and they sent it to her, but then she got a bill because her grant was run out. She wasn't aware that it had been all used up. And another one who they put her on this automatic medication renewal program, and so she just kept getting her meds, and then her grant had run out as well, and they never called and told her. And so when she called, they said, well, you asked us to keep renewing your medication, that didn't count, which to me seems kind of not very kind. So these are just a couple of things to keep an eye on with making sure you're aware of how much is left of that grant, because that's the one thing that can be an issue, and I have had recently. And as I said, unfortunately, I'm sorry, because that is certainly an extra stress for you all to put on your plate. These grant programs do need to be renewed each year, and hopefully when we're looking at next year, that will be a little bit better. They'll be open more than they've been closed, I'm hopeful. And that each fund is open at 11 a.m., or the funds all open at 11, so if they have money, 11 a.m. Eastern Standard Time. I know a lot of the pharmacy techs told me, the pharmacy programs I worked with, that they check that like 11 a.m. and other times of the day, but definitely check then. All right. So patient assistance programs. So this is the free medication programs through the manufacturers. So BI Cares is the free drug program under OFEV, which is Boehringer Ingelheim, which is also under their Open Doors program. Both of these have specific forms you have to sign. BI also requires additional paperwork. They will ask for like a tax statement, a Social Security statement, some form of income, as well as your provider will have to send a form. Now for BI Cares, they do ask for your assets. When I talk to them, they don't count the assets towards your income, because you have to be less than 500% above the national poverty level, unless you get money from whatever that asset is. Let's say you have a second home and you rent it out, they have to count that income. They do ask for your assets, but they only include that if you're getting money off those assets. I know sometimes if you have a certain account that you saved up for retirement and you have to pull out money from that account, they'll have to count that money into your income for the year. Genentech has a little bit, I think I have it under listed here. It's based on your household and how much you make in that calendar year. So one thing is for OFEV that I found out, so if you are approved for free drug for OFEV, which I just did for someone November, like right before I came here, she has to reapply January of the next year. So we just did her paperwork for November of 2023, but in January of 2024, she has to redo all that paperwork. So if you have a free drug through this program, look for the paperwork. They're going to be sending it to you. You're going to have to get all your tax statements together. You're going to have to get that form to your physician to fill out, so all that can be turned in. Now, I know for a lot of for BI Cares, they do send, in general, I think a 2 or 3 month supply, so that will help to kind of carry this particular person over. And then for the Esprit, when your pulmonary team does the prior authorization, it has to be for Esprit, the brand name, not pirfenidone, and that's required for their free drug program. And I also want to mention, so we have a lot of folks who run out of their grants, and we try to get them to the free drug program, which is something I would recommend. Really be cautious, because the free drug programs, the medicine comes from their own specialty pharmacy. So don't keep getting your medicine from the pharmacy you have, because the free drug program is not going to pay that back. Anything you owe to the specialty program, the specialty pharmacy you have been using, you'll have to pay. Once you get the free drug program approved, that medication will come from that manufacturer's specialty pharmacy. So they're 2 different pharmacies. So just important to kind of, I know I've had some folks who've gotten tied up with that, and trying to save you that frustration when that happens. So VA benefits, if you have any VA benefits, use them. They do provide OFEV and Esprit for free. It just has to come from a VA physician. And actually, we've sent the prescriptions to their primary care VA physician, not necessarily a pulmonary physician, and they got it approved. So it's important, if you do have VA benefits, that you take advantage of that. Saves a little extra stress for all the copay stuff. So just some important takeaways. As I mentioned, the specialty pharmacy does need to tell you how much the medication is before they ship it to you. So I don't want you to worry that you're just going to get the medication in the mail. And I did mention those 2 issues that occurred once they had a grant program, that they weren't notified. But in general, you should know how much it is before they send it to you. And you should give them, okay, I'm okay with that cost, send it to me, or I need help with the copay. If your insurance changes, your copay is going to change. So that's really important. And then we talked about the fact that the copay card and the grant programs do have a set amount that once they're out of those funds, you will be, the cost of the medication will be diverted back to you. So the one last thing I'm going to try to talk about, and remember, I'm not an insurance specialist, is Medicare. Medicare has some changes coming up with the Inflation Reduction Act that I'd recommend. And the open enrollment for Medicare, I know, is up until, I think, December 7th. So there's a lot of changes coming to the pharmacy benefits. I think now there you get vaccines free under Part D, and some changes to insulin. In 2024, there's going to be eligibility for expansion of eligibility for the Extra Help program, and some reduced costs to the out-of-pocket expenses that may kind of help there. And in 2025, so that Medicare, that coverage gap, or the donut hole they call, is, I think, going to shrink in how much you have to pay during there. It mentions to $2,000, but that's something just to keep an eye out from this, in the future. It does look like, though, for 2024, that coverage gap, the donut hole will cost, you have to pay $8,000 out-of-pocket costs before you can hit the catastrophic coverage, which would then give you zero. It says beneficiary has 0 drug costs, and the plan will pay the rest of it. So you would have $8,000 out-of-pocket costs total in 2024. Is what this says. So with the open enrollment until December 7th, if you have Medicare, any Medicare Part D prescription plans, please call your Medicare person and just make sure you have the right, Part D program for you. And then, thank you. Please know you're not alone. We are here. The PFF is here, and really the specialty pharmacies are there. So thank you.
So I am a nurse coordinator. So I really work when after, your doctor would prescribe your medication, that's where I would come in. And so I'm just going to kind of go through. Some of this is going to be a little repetitive to what Lori said, so I'm going to move through that part pretty quickly, but I'll just kind of go through the process and how I work with patients and how we work to see what kind of help we can get, what they need, and what we can get, okay? So working with patients for many years, I figured out, things they need. Help with access to treatment, and this includes helping them get their medications approved, and then also with helping them with cost and figuring things out like that, and helping them to know what other resources are available out there. So anybody that's in here on a specialty med, this works differently than your normal medications. And that's probably the first talk that I have when I sit down with patients, is I sit and I say, this is gonna not be your high blood pressure medication that goes to the pharmacy. This is gonna go to a special pharmacy. We're gonna use, it can only go to certain specialty pharmacies. It can't be whichever one you want. I always go with whichever one their insurance prefers, because that will make it the cheapest for you. So always know that, to know what specialty pharmacy your insurance prefers. And they also, I make sure that they understand how this process is gonna work. It's gonna get mailed to them. You're not gonna pick it up. And that there are people at the specialty pharmacy that can help you. They have patient advocates through most of the specialty pharmacies that can help kind of guide you. And then they also have patient support programs that can help with if you're not able to get help anywhere else. These are the ones that most of the antifibrotics use. Like I said, these are limited distribution medications, so you can't get them everywhere. And that's good, because that means that the people that are sending you the medication know all about it. They're not letting somebody who doesn't know anything about the drug ship it to you. They're gonna ask you questions when they call you about, are you having side effects from your medication? How are you tolerating it? And the good thing about it is that when you tell them something's going on, they call your doctor. I don't think that local pharmacies do that very often. So they call us and they let us know, hey, your patient is having a lot of diarrhea, or they are having a lot of stomach upset. So taking advantage of these specialty pharmacies, I think, is very important in this process. They really help and are really an extension of the people that care for you and an extension of your care team. And for any of those of you who have pulmonary fibrosis plus pulmonary hypertension, it goes even further than that, because when you're on medications for those, it actually comes with a nurse from the specialty pharmacy that can come to your home. They teach you how to use the medication, and that's a really good resource and another person to add. It takes a village, you guys know, for people that are living with advanced diseases, and it's important to know everyone that is part of that team and everyone that you can reach out for help and assistance. The other talk that I always have with patients is I tell them, you're gonna get that call, and they're gonna tell you, we expect it to cost this much. And a lot of times that call will scare people away from taking the medication, and I won't know, for a few weeks that they didn't start, and it's because they called them and they got scared. So that's when I learned, I tell them right away, if they call you and they tell you something that scares you, say right away, I cannot afford that. And then somebody is gonna step up and help find you help, whether it's the person on the phone, whether you're calling me, whether it's someone from the patient support program. There's lots of options of places out there for you to ask for help. You just have to know that it's okay. And it doesn't mean anything bad. I know it's hard to ask for help. I am the worst person about asking for help. Anybody who knows me will tell you that. But it's okay. It's important. And you have to be your own advocate more than anyone. So what do we do to find help? So it first starts off whether you have public insurance, which is Medicare, Medicaid, government insurances like TRICARE, or commercial insurance. And things work a little differently based on both of those, like Lori talked about, but this is kind of the flow of how I send patients to ask for help. So if you have public insurance, Medicare, which is a lot of the patients that we treat, because this is a disease that happens in older people, we start with grant programs first, because if you're asking the patient, the manufacturer, to help you pay for the medication and there's a grant program open, they're not gonna help you. They're gonna say you gotta go to the grant program first. So first step is there a grant program? Again, those funds open and close. A lot of them do have wait lists. So if you see one that's closed, but it says waitlisting patients, apply to be on the wait list. So as soon as that wait list opens, they're gonna call you and say, we have money today. Do you still need it? And jump on it if you can. So grant programs first. If you can't get in with a grant program, patient assistance program, that would be the manufacturer of the medication, whether that be the Esprit, the OFEV, or other medications that you take. If you're still running out of luck, then we look at specialty pharmacy. They do have programs available. They don't volunteer that information always, so you have to really have failed all other avenues and get to them and say, okay, I can't find help anywhere, what do I do? And then they will help. From there, look at other programs that can help you. So there's social service programs out there we're gonna talk about in just a second. And then look for discount pharmacies for other medications. So I've actually sat with patients and we've gone through all of their medications and one by one and said, okay, let's lay out the cost. Because let's say you can't pay $1,200 for your OFEV, but you're already paying $300, $400 over here. Like, how can we make this go down so maybe this gets a little better? So we have sat and gone through medication by medication and been able to save them money in other places. There are patient assistance programs out there for anything that is a branded medication almost. So if you're on an inhaler, that's a huge cost. All of them are normally tier 3, 4, or 5, depending on which medication it is, and those are expensive. There are patient assistance programs for inhalers. There are patient assistance programs for medications to take for blood clots. Any sort of branded medication that you take, I guarantee there's a patient assistance program out there for it. So ask your pharmacist, look online, look for help. There are grant programs available for diseases other than pulmonary fibrosis. So I know that most of us don't just have one thing wrong with us. We have more than one thing. We have a lot going on. So maybe I can't get help with my pulmonary fibrosis, but I can get help with my asthma. So it's okay to look at other options. I would say look at all your resources. Like, don't throw your hands in the air until you've hit every avenue of what we can do. So these are grant programs. My list is a little longer because this comes from our webpage that we use, and I'm going to show you guys a QR code for that in a second. So these are all pulmonary diseases, but they cover things other than pulmonary disease. They cover cancers, all kinds of stuff, especially if it's rare. Any sort of rare disease, they definitely cover it. There's lots of focus on rare disease. But these are all of the grant programs that are available, and they do open and close. And if they're waitlisting, again, that's an opportunity for you to put your name on the list and get in line. So she talked about the criteria for most of them. You have to meet financially. Some of them will ask you to prove it. Some of them will not. Different metrics for each one. It's 300 to 400 to 500 above the poverty level, and you do have to reapply annually. And then some will require the form that the doctor supports your diagnosis. When you go to the web, I would advise everyone to apply online. It's so much easier than calling. If you're not computer savvy, have a daughter, a granddaughter, somebody that can help you, because it's much faster than sitting on the phone. And so this will take you to that page that I showed you that had the open grant program. So we open that. Well, this will take you to the website, and then you'll see the financial aid information. But we update it weekly as things open, so that you can always go on there and look. It's for anybody to use. And it also has information about medications. It has inhaler training videos, things like that you can peruse. But it's a resource that's available that I like to share with people. So the patient assistance programs, those are the ones that will help with copay if you have commercial insurance or private insurance. Not available for people with public insurance, like she already said. The trick with this is you have to sign a form saying it's okay for them to call you. So if your doctor is prescribing you a medication, especially a specialty medication, I would make sure that you ask them, like, do I need to sign something? Because if you don't sign, they don't get your information where they can contact you. It's just part of the regulations and how it works. They have a nurse for the antifibrotics that can meet with you from the branded medications, from the branded patient support programs. They will talk about disease state. They will help with other things. I encourage every single one of my patients to take advantage of that. Again, the more people that you have in your village, the better you are. So we talked about getting help in other areas, looking at costs. So this is an example breakdown. These are two of the non-specialty medications that are used to treat pulmonary fibrosis, different types of pulmonary fibrosis. So GoodRx is a discount pharmacy program. You can go online, you type in the drug, you type in the dose, you type in how many tablets you want to purchase, and it will show you all the local pharmacies around you and what they cost. Some pharmacies are cheaper, some are more expensive. If you love CVS, but Walgreens is cheaper, it's okay to still use CVS and pay a little more. But it'll tell you everything that's around you that you can get a cost reduction. This kind of shows you, with the mycophenolate, we do refer patients there often when their insurance isn't paying for the medication. Cost Plus Drugs is a little different because it's an online pharmacy. You have to go on, give them your information. Your doctor can send the prescription electronically, and then they'll ship the medication to your home, so you don't have to go and pick it up. They don't have every medication out there. They're kind of new. They're starting to build up, but these two they do have. And they have other medications like reflux medication, high blood pressure medication. They even have one cancer treatment. So they have other things out there where you can save money. So it's definitely a very useful resource. Can also help when you're in the donut hole, because you know when you're on these really expensive medications or if you're on multiple inhalers, you get to the donut hole pretty quick. So during that time, because this isn't going towards your insurance, this is strictly a discount program for cash pay price. Other resources that are available, I'll give you some links on the next page, but social service resources are very county specific, so they're broken down by county. So you want to know what is available in your county, whether that's help paying for utility bills, and that can be anything from internet service to electricity, help with food. There are some of the grant programs that offer help with medical expenses, not just drug costs, so help with appointments, help with travel, and then if you need help with housing costs. And then these are some of the tools you can use. So benefitscheckup.org is one where you go in and you put in your zip code, and they will show you what kind of social services are available in your area. SSA.gov, that is part of the Extra Help program. So that is a program that you do have to qualify for, but currently it will offer up to $5,000 a year help in medication coverage if you qualify for it. And needymeds.org is one where you can go in and type your medications, and it can direct you towards patient assistance programs. There's other places, if you're not good at filling out paperwork or it makes you nervous or things like that, there are other places out there. I don't use them often because they charge patients to fill the paperwork out for them. But if it's something that you feel like you need help with and you're willing to pay someone to help you get through this process because it's overwhelming, that is available. There's things, RX Helper is one of them. There's other programs like that. So big things to know is don't let cost deter your treatment. We can figure it out most of the time. There are very few options where we haven't been able to figure it out. Make the most of any resources that are available for, and just make sure you ask for help if you need it. Thank you.